Hello, guys. I'm going to discuss what happens in a COVID care center. This is Codicia, a trade fair complex in Coimbatore. Few months back, they converted this trade fair complex into a COVID care center. And I'm going to list out the daily routines that happens in this particular COVID care center and also the positive and negative points as well. Before getting into the topic, here is the fact for the day. Do you know which pandemic is the deadliest that the world has ever witnessed? It is Black Death, and this pandemic has taken the lives of 200 million people. Let's get back to the topic. What can you expect from a COVID care center? The very first thing to be done is you will have to get your name enrolled in the front desk with the ICMR reference number. After collecting all the necessary information from you, the station nurse will allot you a bed number. Right from this moment, you are not supposed to leave the COVID care center unless you get discharged. Any allotted bed will have a pillow and a chair at the disposal. You can expect 6 to 8 feet gap between beds so as to make sure the social distancing is followed. The hall is big enough to accommodate some 300 plus beds and has got good ventilation with enough fans in place. The front desk has got enough medicines for fever, body pain, cold and such issues. The care center gives you a choice to choose between English medicines and Siddha medicine, or you could try both. If any patient is identified to have some complications, they are immediately moved to nearby government hospital. The food part is taken care well. Morning 7 o'clock you're offered coffee. 8:30 breakfast. You get two dishes like idli and pongal, or dosa and upma, or chapati and idli, something like that. 10:30 in the morning, they conduct yoga sessions and teach us breathing exercises. Almost all the patients participate in that. It was really nice. At 11 o'clock, you again get tea and chana or black chickpeas. 12:30, you get the lunch served, rice, a vegetable curry, rasam, fried vegetable and a boiled egg. Evening 5 o'clock you get tea and chana or black chickpeas. Around 8 o'clock in the night you get the dinner. Just like the morning, you will find two dishes, idli, pongal or dosa, upma or chapati and idli, be it breakfast, lunch or dinner. Patients are supposed to come in a queue and collect these. To make sure the patients are not very bored, they play 3 movies every day with a projector in place, and I also found few carom boards in the hall. Ultimately, the organizers have given a thought to the recreation facilities, which is good. Every day they clean the floor once and they make sure the garbages are removed. Apart from this, if the patients have diabetes or blood pressure, the nurses give special care to these patients by testing them twice a day in the morning and in the evening. Swab tests are done and samples are collected on the 5th day, and if your result negative, you are discharged the next day, or your samples will be taken on the 7th day, and if the test results are negative, you will be discharged the next day. If your results are positive on the 5th and 7th day as well, you will be discharged on the 10th day. You will be given a discharge summary when you leave the COVID care center. Now, the positives of the care center. The maintenance is very good in terms of cleanliness and hygiene. No complaints on the food served. They are on time every time. Recreation facilities is a plus. There are enough ambulances to move patients to the nearest government hospital if the patient develop any complications. Yoga sessions is a plus. On the negative side, I don't have much to mention, but 1. The nurses use all manual ledgers to keep the books. Maybe they could use computers to avoid any errors. Otherwise, in simple terms, the care center is very well maintained. Things you need to take with you: clothes for a week, soap, sanitizer, face masks, your plate to eat, and a bucket with mug. These items would suffice. Sincere appreciations and thanks to the corporation and to the state government. Very importantly, healthcare workers, nurses, doctors for extending such good services through these COVID care centers. Thanks for listening. Please do post in